Are you losing interest in food? Or do you never feel hungry at all? If you're concerned that your body is wasting away or you're losing weight and feeling unhealthy, you may check for other symptoms to see if you have a medical problem that can be treated with the right care. You may be able to overcome the challenge and see those once familiar hunger pangs return. Or at the very least, get the nutrition your body needs. Not feeling hungry. 13 possible causes. 1. Anxiety. Anxiety can cause you to lose your appetite. While some people actually feel like nibbling something to ease their anxiety or distract them, many lose their appetite. You might also notice you breathe faster, have palpitations, have a pounding heartbeat, feel faint, or get the feeling of butterflies in your stomach. How to cope. You will need to get help for anxiety or panic disorders from a trained doctor. Breathing exercises can ease the stress and feelings of anxiety. 2. Depression. If you are clinically depressed, your loss of appetite may be accompanied by feelings despair, sadness, guilt, low self-esteem, and irritation toward everyone. You may lose interest in things you normally enjoy doing along with the loss of interest in food. How to cope. Besides the professional help by way of therapy or medications, exercise can help both ease some mental anxiety and lift your mood, making you more open to eating. 3. Irritable bowel syndrome. IBS causes intestinal problems like a change in bowel movements, as well as abdominal pain. But what can also happen is that you lose your appetite due to feelings, buildup of gas, and increased flatulence. How to cope. If you make a few lifestyle changes, you should be able to ease some of the symptoms. Stimulants like cola, tea, or coffee stimulate the intestines and should be reduced. Exercising, for instance, can really help. 4. Oral thrush. Candidiasis, a fungal infection of the mouth, can cause a decrease in appetite due to the other symptoms associated with the infection. Easiest symptom to spot are white patches of plaque that form on surface of the inside of your mouth. How to cope. Don't assume the infection will just go away. It could spread to other parts of the body and that's dangerous. Ensure you practice good oral hygiene, always rinsing your mouth well after meals, brushing twice a day, flossing, and having regular dental checkups. 5. B12 or iron deficiency anemia. Not getting enough vitamin B12 can cause a loss of appetite. It can cause confusion, depression, or even dementia, a loss of balance, as well as tingling. How to cope. Taking a B12 shot or supplements may be recommended by your doctor. In addition, ensure you have a balanced diet that includes plenty of poultry, dairy, shellfish, eggs. Sleep and exercise are important to help with overall recovery. 6. Anorexia. Eating disorder. Anorexia is marked by a loss of appetite. Eating a highly calorie-restricted diet, limiting what you eat, exercising too much, using laxatives, and purging your body, inducing vomiting, and even binge eating may be other signs you have anorexia. How to cope. Cognitive analytic therapy, cognitive behavioral therapy, interpersonal therapy, focal psychodynamic therapy, and family interventions are the usual line of treatment. 7. Cancer and treatment side effects. Those with cancer may experience an altered sense of smell or taste which can hamper their appetite. A tumor may sometimes grow, interfering with feelings of hunger. How to cope. Don't try and eat big meals. Instead, have several mini meals throughout the day. Increase the calorie content of the food you do eat so it is nutrient-dense and calorie-rich. 8. HIV. Human immunodeficiency virus (HIV) can cause weight loss as a result of a loss of appetite. You may not feel hungry due to opportunistic infections like candidiasis, cryptosporidiosis. These tend to make the most of the low immunity of your body to attack. How to cope. You may need to eat high-calorie meals that are rich in protein to prevent all your muscle from wasting away. Include foods like cheeses, legumes, eggs, peanut butter, etc. Do some strength-building exercises like gentle weightlifting or resistance training. 9. Liver problems and jaundice. Liver disease and early-stage liver failure are marked by a loss of appetite along with nausea, diarrhea, and fatigue. As the condition progresses, you may also find yourself feeling confused, disoriented, or very sleepy. Symptoms of cirrhosis include easily bruising, easily bleeding, jaundiced yellow eyes and skin, water buildup in the abdomen and legs, toxic buildup, and itchy skin. Hepatitis and chronic liver disease are liver problems that have similar effects on your appetite. How to cope. If your liver problems are rooted in fatty liver disease or alcohol consumption, abstain from drinking alcohol for a few weeks. After that, only drink within recommended guidelines. After treatment, as other symptoms ease, your appetite may also improve again. 10. Medication side effects. Certain medications may cause a loss of appetite. You may not feel very hungry and may not want to eat at all. These include chemotherapy drugs, morphine, codeine, and antibiotics. In addition, if you use drugs like heroin, cocaine, or amphetamines like speed, you could end up killing your appetite as well. How to cope. If there are no alternative medications you can take, you will need to learn to just eat because you have to. However, if you're abusing street drugs, there are many reasons to try and quit for your health. Get professional help if you need to. 11. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, a term used to describe a range of progressive lung diseases like chronic bronchitis, some kinds of bronchiectasis, emphysema, and refractory asthma, can cause appetite loss in addition to breathlessness, tightness of the chest, wheezing, and frequent coughing. This anorexia develops as a result of inflammation as well as hormonal derangement. Breathing becomes more of an effort and costs more oxygen, which is why those with COPD tend to have low body weight. How to cope. Besides treatment for COPD, which may include medication as well as cutting out triggers of lung irritation including smoking, increasing nutritional intake may help. Nutritional supplements along with pulmonary rehabilitation to improve breathing. 12. Alzheimer's disease. Having Alzheimer's disease can also cause trouble for your weight. Not getting enough nutrition could worsen the condition. How to cope. Get the help of a family member or caregiver to plan or help with meals. If possible, eat together. Work out a menu plan with different foods and plenty of fresh produce, lean protein, and low-fat dairy. Option for fruits and fruit juices to satisfy your sweet tooth. 13. Heart failure. Heart failure can cause eating and digestive symptoms like loss of appetite, as well as constipation, nausea, and vomiting. Shortness of breath and fatigue also make it harder to get in enough food and nutrition. How to cope. Besides the treatment for your heart problem, when it comes to food, a few small changes can make a world of difference. For instance, switch to multiple mini meals instead of large meals. Pick things you enjoy eating. Have easy to digest and easy to have foods like soups or stews. When you're eating, ensure you are in a room that is well ventilated and keep the windows open. Sit upright to help ease airflow.